One of the earliest whispers your heart may send is through its rhythm. You may notice that while you are sitting calmly, reading a book, or even drifting off in your favorite chair, your heart suddenly starts racing or beating harder than usual. This is not the kind of racing that happens after a brisk walk or climbing stairs. It happens when you are still, without any clear reason, and it can leave you surprised or unsettled. Many people describe it as a fluttering in the chest, a heavy pounding, or even an unexpected thump that interrupts an otherwise peaceful moment. Normally, when your body is at rest, your heart beats steadily between 60 to 100 times per minute. But when the heart muscle weakens, it has to pump harder to keep blood flowing, even when you are doing nothing at all. That extra strain makes the heart beat faster than normal, almost as though it is overcompensating, trying to do the work it once managed with ease. Over time, this faster resting heart rate wears down the heart further, creating a dangerous cycle. Studies from the American Heart Association show that people with a consistently high resting heart rate face greater risk of early heart failure and complications. What seems like a harmless flutter or brief pounding could, in fact, be your body signaling distress. That is why paying attention to your resting pulse matters. A simple home device like a wrist monitor or even a smartphone app can help you check your pulse regularly. If you notice that your resting heart rate is consistently above 100 beats per minute, that is not something to ignore. Logging these readings and bringing them to your doctor can provide important clues before more serious symptoms appear. Even if you feel fine otherwise, those little episodes of racing or irregular heartbeat are worth listening to, because they often arrive long before dramatic events like chest pain or collapse. Another important sign that often shows up much more visibly is swelling in your lower body. Many people dismiss this as tired feet, or the natural result of being on their legs all day. But when your socks leave deep marks around your ankles or your shoes feel tight by evening, your body may be telling you something deeper. When the heart cannot pump strongly enough, blood begins to back up in the veins of your legs. This pressure pushes fluid into surrounding tissues, leading to swelling in the feet, ankles, and calves. Unlike normal puffiness that might go away with rest, this swelling tends to worsen as the day goes on and often affects both legs at once. Doctors call it peripheral edema, and it is one of the most common early red flags for heart failure. A simple way to check at home is to press your thumb against your shin. If a dent remains for several seconds, that is a sign of fluid buildup that deserves medical attention. The swelling itself may not be painful, but it reveals how the heart is struggling to circulate blood properly. Left unaddressed, this fluid can continue to accumulate not only in the legs but in the abdomen and lungs as well. By noticing this change early, you can speak to your doctor before it progresses to something far more dangerous. Alongside swelling, many people begin to notice that everyday activities suddenly feel harder because of breathlessness. Tasks that once seemed effortless, like walking out to the mailbox, climbing a few stairs, or carrying groceries, may now leave you pausing to catch your breath. This is one of the most telling early signs of heart failure. When the heart is unable to pump blood efficiently, it causes blood to back up into the lungs. That backup makes it harder for oxygen to pass into the bloodstream, leaving you winded from even light exertion. Some dismiss this as being out of shape or simply getting older, but research shows that breathlessness with mild activity often appears years before an official diagnosis of heart failure. It is not about fitness, it is about circulation. If you notice that you are struggling to breathe more often during simple routines, or that you need to stop and rest after tasks you once did easily, that is a signal worth documenting. These details can help your doctor see whether your heart is quietly under strain. Another subtle but powerful sign comes not from what you do during the day, but from what happens almost overnight. Stepping on the scale and seeing a sudden increase of 2 or 3 pounds in just a day or 5 pounds in a week can be alarming, especially if you have not changed your eating habits. This weight is not from food, it is from fluid, your body is holding onto because the heart is not pumping strongly enough to keep up with circulation demands. The kidneys respond by retaining more salt and water, and this hidden fluid accumulates in tissues throughout the body. It may cause swelling in the belly, tighter clothes, or difficulty breathing in addition to the rising numbers on the scale. For this reason, many doctors recommend weighing yourself at the same time each morning and recording the results. Even a small but sudden change can be the body's early alarm. Ignoring it can allow the condition to worsen, but catching it quickly can lead to interventions that protect the heart and ease the strain. Fatigue is another constant companion for many people with early heart failure, though it is often brushed aside as just a part of aging. Unlike normal tiredness that improves after a good night's sleep, this kind of fatigue lingers no matter how much rest you get. The reason is that a weakened heart cannot supply enough oxygen-rich blood to your muscles and organs, leaving the body in a constant state of low energy. Simple chores like folding laundry, showering, or making a meal can feel exhausting. Over time, you may find yourself avoiding activities you once enjoyed because of how draining they feel. This kind of deep fatigue is not something to ignore. It reflects the heart's struggle to meet your body's basic demands, and it can progress slowly enough that you barely notice the decline until it is severe. Paying attention to how much energy you have for daily life can reveal more about your heart than you might expect. Finally, one of the quieter yet equally important signals is how often you feel dizzy, foggy, or lightheaded. Standing up quickly and feeling the room tilt for a few seconds might seem harmless, but if it happens regularly, it can point to reduced blood flow to the brain. Similarly, episodes of forgetfulness, difficulty focusing, or losing track of conversations can be tied to poor circulation. The brain depends on a steady stream of oxygen-rich blood, and when the heart struggles to deliver it, mental clarity suffers. These moments are not just slips of memory or signs of age. They are warnings that your heart may not be keeping up with the demands of your body. Tracking when dizziness or fogginess occurs, whether after exertion or late in the day, provides doctors with critical information about how your circulation is functioning. More importantly, it protects you from the risks of fainting or falling, which can be especially dangerous for older adults. By the end of the day, you may have noticed something that seems small at first but actually tells an important story about what is happening inside your body. You pull off your socks and see deep grooves pressed into your skin, or your shoes that felt perfectly fine in the morning now feel tight and uncomfortable. This swelling in your feet, ankles, or lower legs is more than just the ordinary tiredness that comes from standing or walking. It is one of the earliest and most common outward signs that your heart may be struggling. When the heart cannot pump efficiently, blood begins to pool in the veins of the legs. That extra pressure pushes fluid into the soft tissues under the skin, creating puffiness that gradually worsens throughout the day. Unlike the normal swelling from heat or long hours on your feet, this type of swelling, known as peripheral edema, often affects both legs at once and becomes more noticeable in the evenings. It is the kind of change you might brush off or blame on shoes, age, or even diet, but it is actually a signal that circulation is not working the way it should. What makes this symptom particularly tricky is that it usually develops slowly. One day, you notice a faint sock mark, another day your favorite shoes feel snug, and before long, you are accustomed to ending each day with puffy ankles. Because it doesn't hurt and doesn't stop you from going about your activities, it's easy to dismiss. But beneath the surface, what is happening is that your heart is struggling to move blood forward, and the fluid that should be circulating is seeping out into your tissues. The longer this continues, the more strain it puts on your body. That's why doctors often ask patients with suspected heart problems about swelling, because it can be a very early clue. A simple home test can help you see whether what you're experiencing is more than ordinary puffiness. Gently press your thumb into the front of your shin for a few seconds, then lift it away. If a dent remains in your skin instead of springing back right away, that is a sign of fluid retention that deserves attention. This pitting edema, is one of the telltale features doctors look for when evaluating heart health. And while swollen ankles may seem harmless, they can actually be the body's way of warning you that pressure is building up in your veins and circulation is under stress. As fluid continues to accumulate, you may notice that it creeps upward, affecting not only your ankles but also your calves and even your thighs. Some people describe their legs as feeling heavy or tight, as if they are carrying extra weight around. For others, it can make walking more tiring or make socks and pants uncomfortable. In more advanced cases, this swelling can extend into the abdomen, creating bloating or pressure around the waist. That is why keeping track of changes in your body, even small ones like tighter shoes or evening puffiness, can be so valuable in spotting problems early. It is important to recognize that swelling from heart failure is different from swelling caused by things like hot weather, a salty meal, or a long plane flight. While those situations can cause temporary fluid retention, the swelling usually improves quickly with rest, elevation, or hydration. Swelling tied to heart issues, on the other hand, tends to return day after day, often getting gradually worse. It can also be accompanied by other symptoms, like sudden weight gain, fatigue, or shortness of breath. The pattern of when and how it appears can be very telling. If you notice your ankles puffing up regularly, especially when paired with other subtle changes in how you feel, it's worth writing down and bringing up with your doctor. The National Heart, Lung, and Blood Institute emphasizes that fluid buildup in the lower body is one of the most reliable early indicators of heart strain. By the time swelling becomes noticeable, the heart has often been working overtime for quite a while. That is why action at this stage can make such a difference. Elevating your legs during the day, reducing salt intake, and monitoring your weight can help slow fluid retention. But these steps are not substitutes for medical guidance. They are simply ways of giving your heart a little relief while you work with your doctor to find out the underlying cause. For many older adults, one of the most overlooked aspects of swelling is how much it can impact daily comfort and independence. What starts as a faint mark on the ankle can eventually lead to legs that feel stiff, sore, and harder to move. Walking longer distances may feel more challenging, and even climbing stairs can become tiring. These physical changes can slowly chip away at confidence and mobility. Yet, when the swelling is recognized as an early sign of heart stress, there is an opportunity to step in before those limitations set in. By listening to your body early, you can protect your circulation, preserve your strength, and maintain the quality of life you want to keep. Perhaps the most important thing to remember is that swelling is not just about your legs. It is your body's way of communicating that something deeper is going on. Your legs may be the first place you see it, but the true issue lies with how effectively your heart is moving blood throughout your system. Ignoring it may allow strain to build until other symptoms appear: shortness of breath, fatigue, dizziness. But paying attention to it now opens the door for early support and treatment. Each time you take off your socks and see those grooves, or each time your shoes feel tight for no reason, consider it a message from your heart. Small changes in your body often carry big meaning, and this is one signal that deserves your attention before it grows into something harder to manage. One of the most unsettling, yet often overlooked early signs of heart trouble is the growing feeling of being out of breath during activities that once felt effortless. You may notice that simply walking from one room to another leaves you pausing for a moment to catch your breath, or that climbing a short flight of stairs suddenly feels like a challenge. Even carrying a basket of laundry or bending to pick something up can leave you winded. Many people brush this off, thinking they are just out of shape or that age is finally catching up with them. But when shortness of breath begins showing up in everyday life, especially with light effort, it can be one of the clearest signals that the heart is struggling to keep up. The reason this happens is tied to how the heart and lungs work together. In a healthy body, the heart pumps oxygen-rich blood from the lungs to the rest of the body with each beat. When the heart begins to weaken, however, it cannot push blood forward as efficiently. This backup causes fluid to accumulate in the tiny air sacs of the lungs, making it harder for oxygen to move into the bloodstream. The result is that you may feel short of breath even when you are not exerting yourself very much. Instead of air flowing freely, it feels as though you are not getting enough with each breath, and the smallest task becomes tiring. Some people describe it as a heaviness in the chest or the sensation of not being able to take a deep breath. Others simply say they get winded more quickly than before. What is important is the change. The way breathing feels different now compared to what you were once able to do. If walking to the mailbox or talking while climbing a few steps leaves you gasping, that is not just aging. It is the body sending an early alarm that circulation is not functioning as it should. Another time this shortness of breath often shows up is when you try to sleep. You may notice that lying flat in bed makes breathing harder, forcing you to prop yourself up with extra pillows or even sleep upright in a chair just to feel comfortable. This happens because when you lie down, fluid that has collected in your legs during the day redistributes into the chest area, placing extra pressure on the lungs. In a strong, healthy heart, this shift is not a problem, but when the heart is already weak, it creates the suffocating feeling of being unable to breathe deeply while lying flat. Waking up suddenly at night gasping for air is another version of this, and while it is frightening in the moment, it is also an important signal that should not be ignored. Research has shown that breathlessness during simple activities often appears years before a formal diagnosis of heart failure is made. In fact, many patients later realize that their early symptoms were brushed aside for months or even years because they thought they were just slowing down with age. This delay can allow the condition to worsen quietly. The good news is that noticing these changes sooner gives you a chance to act before the problem becomes severe. Tracking when and where you feel short of breath can help doctors see the bigger picture. For example, do you notice it mostly when climbing stairs while carrying groceries, or when lying down at night? Does it improve after resting, or does it linger? Writing these details down may seem simple, but they can provide critical clues about how your heart is functioning. One of the most frustrating aspects of this symptom is how it limits your daily life. Activities that once brought joy or gave you independence, gardening, walking with a friend, or even cooking a meal, may now leave you too tired to continue. That loss of stamina can slowly chip away at confidence, making you hesitant to be active at all. But the worst thing you can do is ignore it or push through, believing it will get better on its own. Shortness of breath is not a matter of willpower. It is the body's way of forcing you to pay attention. There are small steps you can take to make life easier while waiting for medical evaluation. Moving at a slower pace, taking breaks, and avoiding heavy lifting can help reduce the burden on your heart. Sitting down when breathlessness strikes, practicing calm breathing, and keeping a fan nearby can also provide some relief. But while these steps may ease discomfort in the moment, they do not address the underlying issue. The real key is acknowledging the symptom and sharing it with your doctor as soon as possible. What might feel like nothing more than getting winded during a walk can, in fact, be your body's earliest and most important alarm. Every short breath is your heart asking for help. By tuning in and noticing the difference between normal exertion and unusual breathlessness, you give yourself the opportunity to protect your health, preserve your energy, and prevent this quiet signal from turning into a crisis. Sometimes the scale tells a story that food and exercise cannot explain. You wake up one morning, step onto the scale as usual, and notice the number has jumped by 2 or 3 pounds overnight. At first, you might shrug it off, thinking maybe you ate a salty dinner or drank more water than usual. But then it happens again, and by the end of the week, you are suddenly 5 pounds heavier without changing your diet or activity. This kind of rapid weight gain is not the same as slowly putting on weight over months or years. It is often the result of hidden fluid building up inside your body, and it can be one of the earliest signs that your heart is not keeping up with its workload. When the heart begins to weaken, it cannot pump blood forward as effectively as it once did. That sluggish circulation has a ripple effect on the rest of the body. The kidneys, which normally filter fluid and maintain balance, start to hold on to extra salt and water. The body stores this excess in tissues and cavities, creating a rise in fluid volume that shows up on the scale almost immediately. Unlike normal weight gain, which is tied to calories, this increase comes from swelling. You may not always notice at first. It can collect in the legs, ankles, and feet, in the belly, or even in the chest where it makes breathing harder. The scale becomes one of the first places this change is visible, and it is why doctors often recommend that anyone with suspected heart issues weigh themselves daily. The American Heart Association notes that gaining more than 2 to 3 pounds in a single day or more than 5 pounds in a week is a warning sign that fluid retention is progressing. While that might not seem like much in the grand scheme of things, those extra pounds represent several cups of water now sitting inside your body where it does not belong. Left unchecked, that fluid can continue to build until it becomes dangerous, filling the lungs and straining the heart even more. What begins as a small, mysterious rise on the scale can quickly evolve into swelling, shortness of breath, and fatigue if the underlying problem is not addressed. For many people, this symptom sneaks up because they do not weigh themselves regularly. Without a daily habit of checking, you might not notice the sudden changes until your shoes feel tighter or your waistband no longer fits by evening. That is why keeping a routine can be so powerful. Weighing yourself at the same time every morning, ideally after using the bathroom and before breakfast, provides the most accurate picture. Recording those numbers in a simple notebook or even a smartphone app creates a log that you can share with your doctor. Seeing those day-to-day changes written out can reveal patterns you might otherwise miss. The tricky part is that sudden weight gain often gets misinterpreted. People blame themselves for overeating or not exercising enough, when in reality the cause has nothing to do with food at all. This can create unnecessary guilt or make someone delay seeking help because they think they just need to get in shape. But no diet or workout will solve fluid buildup caused by a weak heart. Recognizing that this is a medical issue rather than a lifestyle slip is key. It shifts the focus from self-blame to getting the right support. It is also important to pay attention to where you feel the difference. For some, the extra fluid gathers in the belly, leading to bloating and the uncomfortable sensation of being full after only a few bites of food. Others may notice their rings fitting tighter or their legs leaving dents where socks press against the skin. Even subtle changes in how your clothes fit can be part of this picture. These details matter because they help your healthcare provider see how your body is responding to stress. Rapid weight gain from fluid is not just a number on a scale. It is the body's way of shouting for attention. The heart is working harder than it should. The kidneys are holding on to what they normally release, and your tissues are bearing the burden. By noticing this change early, you give yourself the opportunity to step in before it leads to more severe complications. Many doctors adjust medications or recommend lifestyle changes at this stage that can ease the workload on the heart and help your body release the extra fluid. The earlier this happens, the better the outcome. Perhaps the most reassuring thing is that this is one of the easiest signs to monitor at home. Unlike dizziness or fatigue, which can be hard to measure, a scale gives you a clear, objective number. That number, tracked over time, becomes a powerful tool for protecting your health. The simple act of weighing yourself every day may feel small, but it can provide the first clue that something bigger is happening inside your chest. It is like having an early warning system right in your own bathroom, one that can alert you long before the problem escalates. So when you see those sudden jumps in weight, do not brush them off as water retention from a salty meal or assume it will go away on its own. Pay attention, write it down, and share it with your doctor. That mysterious rise of a few pounds may be your body's earliest way of telling you that your heart needs care. And by listening closely, you can act before that quiet signal turns into a serious emergency. There is a kind of tiredness that feels different from the ordinary fatigue of a long day. It lingers, weighs you down, and does not improve no matter how much rest you get. Many people experiencing early heart trouble describe it as a deep exhaustion that seeps into their bones, leaving them drained even after a full night's sleep. This is not the normal slowing down that comes with age, nor is it the temporary fatigue after physical exertion. It is a persistent weariness that shows up in everyday life and refuses to let go. When the heart weakens, it cannot pump enough oxygen-rich blood to fuel the body's muscles and organs. That shortage means your tissues never get the full energy supply they need, and the result is constant fatigue that colors nearly every part of your day. At first, you may notice it only during certain activities. Folding laundry might leave you needing to sit down halfway through, or a short walk to the mailbox could leave you feeling heavier than usual. Over time, the fatigue grows more noticeable. Tasks that used to be automatic now demand effort. Carrying groceries, making the bed, or cooking a simple meal begins to feel like a chore that taxes your strength. Even things you once enjoyed, gardening, meeting a friend for coffee, or taking a stroll, may become things you hesitate to do because of how tired you feel afterward. This slow, creeping change is easy to dismiss, especially if you chalk it up to aging. But the truth is that this level of exhaustion is often your heart telling you that it cannot keep up with your body's needs. The reason behind this symptom is straightforward but profound. Every cell in your body relies on oxygen carried in the blood to create energy. When the heart is strong, it pumps blood efficiently, delivering that oxygen to every corner of the body. But when the heart weakens, circulation slows and the supply dwindles. Muscles, nerves, and organs all begin to run on less fuel than they need, and the result is fatigue that no nap can cure. In many cases, people with heart failure also experience reduced exercise tolerance, meaning they cannot perform physical activities at the same level they once could. This is not about willpower or motivation. It is about biology. Without enough oxygen reaching the tissues, the body simply cannot function at full capacity. One of the most frustrating aspects of this kind of fatigue is how invisible it seems to others. Friends or family may think you are just tired, or that you are slowing down with age. They may not understand why simple tasks leave you so drained. But inside, you feel the weight of it every day. It is not laziness, and it is not weakness. It is a symptom, just as real as swelling ankles or shortness of breath. Recognizing it as such is the first step in taking it seriously. The medical community has long recognized fatigue as one of the earliest and most disabling symptoms of heart failure. Studies published in journals like Circulation confirm that reduced stamina and chronic exhaustion often appear well before a diagnosis is made. Many patients recall years of feeling unusually tired without realizing it was tied to their heart. That is why it is so important to notice patterns now, rather than waiting for other, more dramatic symptoms to appear. If you find yourself unusually tired after minor exertion, or if rest no longer restores your energy, that is a sign worth documenting. Keeping a simple journal of your daily energy levels and noting what activities leave you fatigued can provide invaluable clues to your doctor. This symptom can also take a toll on your independence and quality of life. When everyday tasks feel draining, it is tempting to stop doing them altogether. Over time, this can lead to less movement, less social interaction, and a gradual withdrawal from activities that bring meaning and joy. That isolation only deepens the fatigue, creating a cycle that is difficult to break. The earlier you recognize that your energy loss is tied to your heart, the sooner you can intervene to protect not only your health, but also your sense of vitality. There are small ways to cope while you seek medical guidance. Pacing yourself, planning breaks during the day, and prioritizing tasks can help conserve energy. Some people find it helpful to schedule the most demanding activities for the time of day when they feel strongest. Light exercise, guided by your doctor, can also support circulation and improve endurance over time. But it is critical to understand that these are management strategies, not solutions. The real issue lies in how well your heart is delivering blood, and only a healthcare provider can address that directly. It may be tempting to brush off persistent fatigue as a nuisance or convince yourself that it is simply part of getting older. But when tiredness becomes the backdrop of your life, interfering with even the smallest routines, it is much more than that. It is one of the body's clearest ways of saying that the heart is not functioning as it should. Each time you feel too tired to finish a task that once came easily, consider it not as weakness, but as a message. Your body is asking for help, and listening now can prevent far greater struggles later. There are moments when the room feels like it tilts, your vision blurs for a second, or your thoughts become hazy in a way that makes you pause. Many people brush these experiences off, blaming low blood sugar, standing up too quickly, or simply being tired. But when dizziness and brain fog begin to appear often, especially alongside other subtle changes in health, they can be an early warning that the heart is not functioning as it should. These symptoms may seem mild compared to chest pain or shortness of breath, yet they reveal something important. The brain is not getting the steady flow of oxygen-rich blood it depends on. When the heart weakens, it cannot pump with enough force to deliver blood to every part of the body efficiently. The brain, being one of the most sensitive organs, notices this shortage right away. A brief drop in circulation can cause lightheadedness, the sensation that you might faint, or even actual fainting spells in some cases. For others, the effect is less dramatic but equally troubling. The mind feels foggy, concentration slips, and everyday thinking becomes harder. Forgetting why you walked into a room, struggling to follow conversations, or finding it difficult to focus on reading the newspaper may all be part of this picture. While many assume this is just normal aging, it can in fact be the brain reacting to reduced blood supply caused by heart issues. One of the most common times dizziness appears is when standing up after sitting or lying down. This sudden drop in blood pressure, known as orthostatic hypotension, is often more noticeable when the heart is weak and circulation is sluggish. The result is a fleeting moment of unsteadiness or the need to grab onto something for balance. Though brief, these moments can be dangerous, leading to falls that have serious consequences, especially for older adults. What feels like a simple dizzy spell may actually be an important clue that the heart is struggling to maintain stable blood pressure. Brain fog, though harder to define, can be just as disruptive. People often describe it as a heaviness in their thinking, a sense that their mind is wrapped in cotton, or that clear thoughts slip away before they can fully grasp them. This mental cloudiness can interfere with managing daily tasks, remembering appointments, or even feeling confident in conversations. It may seem unrelated to heart health, but when the brain is consistently undersupplied with oxygen, clarity naturally suffers. The frustrating part is that this fogginess tends to come and go, making it easy to ignore until it becomes a regular part of life. Researchers have long studied the link between poor heart function and cognitive changes. Studies published in journals such as the Journal of the American College of Cardiology have shown that people with early heart failure often score lower on memory and attention tests compared to those with healthy hearts. This does not mean that every dizzy spell or moment of forgetfulness points to heart failure. But when these symptoms appear alongside others, like swelling, fatigue, or shortness of breath, they paint a clearer picture. The body rarely sends just one signal. It whispers through several small changes, each one offering a chance to pay attention. What makes dizziness and brain fog particularly concerning is how they affect safety and independence. Feeling lightheaded in the kitchen can lead to spills or burns, and losing balance in the bathroom or on the stairs can result in falls that change life in an instant. Mental fog can make it harder to manage medications properly, remember doctor's instructions, or keep track of bills and appointments. These ripple effects often go unnoticed until they cause real disruption, but recognizing the connection early allows for preventive steps. There are practical ways to cope with these symptoms day to day while waiting for medical evaluation. Standing up slowly, Pausing before walking and using support when moving from one position to another can reduce the risk of dizziness. Drinking enough water and avoiding sudden movements may also help. For brain fog, keeping notes, using reminders, and simplifying routines can make life easier. But it is important to remember that these are only short-term adjustments. They do not address the root cause, which is often tied to how well the heart is keeping the brain supplied with blood and oxygen. For many people, admitting that dizziness and forgetfulness are more than just quirks of aging can be difficult. It is tempting to laugh off the clumsiness or joke about senior moments. Yet, behind those jokes, the body may be sending a serious message. Paying attention to these subtle shifts rather than dismissing them can mean catching heart problems at a stage when they are still manageable. Every dizzy spell and every foggy thought is like a nudge from within, urging you to take a closer look at what is happening inside. So, when you notice that your balance feels less steady or your mind seems cloudier than usual, pause and consider why. It may not be just fatigue, dehydration, or age. It may be your heart struggling to keep the brain supplied with the steady nourishment it needs. By listening to these signals and sharing them with your doctor, you take an important step toward protecting both your heart and your independence, ensuring that what feels like a minor inconvenience today does not grow into a major health crisis tomorrow.